Hello there. Welcome. My name is Calliope, and I'm going to be taking some information from you, if that's okay. Excellent. So, first, would you mind just confirming your name and date of birth? Excellent. Excellent. And what is Dr. Yvette seeing you for today? I see. Okay. All right. Well, I am so sorry to hear that you're experiencing those symptoms. I'd like to ask you a little bit about them, if that's all right with you. Okay. First, would you mind telling me everything that you are experiencing? Right, all of your symptoms. Good. All right. And when did your symptoms start? Do you recall? Even just a month would be good. Okay. Okay, very good. And how often do you experience these symptoms? Either on a monthly basis, a weekly basis, a couple times a week, a couple times a month. Okay, I see. Okay, and on a scale from 1 to 10, with 1 being not severe at all, and 10 being the most severe you've experienced in your life, how severe are these symptoms for you? Okay. And have these symptoms been impeding your daily activities? Whether it's been your work or your hobbies, your social life, anything like that? And is there a time of day or perhaps an event that the symptoms are worse at? For example, in the morning, at night, when you go to work, after you come home, if you go outside, any of those ring a bell? Okay. Excellent, okay. And is there a time or event where your symptoms are better? When you're sleeping, sure. Anytime else? Okay. Very good. And is there anything that you have found makes the symptoms worse, or any possible triggers? Okay. And anything that makes it better? Have you tried any sort of treatment at all? Whether this is seeing some other sort of medical professional or perhaps seeking out alternative treatments, trying any over-the-counter medicine, anything like that? Okay. And did any of that work for you? Even just with alleviating maybe some symptoms or reducing the severity? Okay. Okay. I'm going to ask you a little bit about your general medical history now. So, how are you feeling right now? Yeah. Okay. And any current pain or illness right now? Okay. And any acute or chronic conditions affecting you? This could be like an injury or asthma, diabetes, cancer, things of that nature. Okay. And any family medical history of any major illness, like, say, asthma, diabetes, cancer, heart disease, COPD, anything like that? Okay, and is that your maternal side or your paternal side? Mother or father? Okay. All right. And do you have any allergies? Whether they're environmental, food, medication? Okay. And are you currently on any medications? Okay. And what is that used for? Okay. And what's the dose on that? Okay. And how often do you take that? Okay. All right. Any other medications? Okay. And what is that used for? Okay. What's the dose on that? Okay. And what's the frequency that you take that at? Okay. Very good. Okay. Do you have anything to add that you may think would be pertinent to your appointment? Okay, well, if you think of anything, you can certainly let Dr. Yvette know. So we are all checked in, and I will let her know that you are ready for your examination. I hope it goes well for you, and I really hope that you're able to figure out what's going on so that you can be treated, okay? All right, I hope you have a whale of a day, and good luck.
Good afternoon. Thank you for coming in. Please try to make yourself comfortable if you can. I'm just going to take a moment to go through some of the notes so that Calliope has documented here and just kind of go over some things with you. Okay. Is there anything I can do to make you a little bit more comfortable? Any kind of beverages, lighting preferences, things like that, anything? Alrighty. Well, if there is anything that comes up, just let me know, okay? So, it looks like some of the notes here that Calliope has taken down goes through some of your medications, family history. So the symptoms that you've been describing, they don't appear to be related to any of the medications or having any kind of mixing side effects between those medications should not usually result in some of the things that you've been describing. So family history does have a little bit of cardiovascular illnesses to be mindful of. Okay. Do you know much about them, or is it more of just a general knowledge of it? Okay. All right, let me just write that down here real quick. Yeah, I can definitely see that would be a concern. Yeah, kind of alarming. Our main intent is not to alarm, but knowing is a lot of the times very, very helpful in being proactive so that there isn't alarm. And that's really what we're going to focus on. And anytime that you're experiencing dizzy spells or the feelings of being very disconnected, cardiovascular health is in many cases a cause for some people, especially if you have a family history of it. So finding an answer for that it may not be good news, but at least it would be something that you could proactively work with and, minimize some of the struggle with that too. Okay. So with that general history of your family, do they have any kind of care that they receive? Do you know anything beyond their diagnostics? What they do to help maintain themselves? Okay. All right, and you're wondering if that same treatment might be fitting for you. Okay. Well, if it's okay with you, starting with part of the physical exam is to narrow down what might be causing these symptoms. If it's okay with you, I'd like to just take a moment to inspect your physical body, the temperature of your skin in various areas, your pulse, if there's any areas where you have elevated heat sensations, things like that. Is that going to be okay with you? Okay. Can I start with your wrists here? I just want to place my hands on both of your wrists and palms up. Okay. Is it okay if I touch you? Go ahead and just try to breathe normally. So what I'm making note of here is that your pulse does seem to be symmetrical on both sides. So that's good. Go ahead and relax. Okay. And can you hold out your hands like this and spread your fingers apart and just kind of elevate your arms a little, okay? I'm looking for any kind of tremors or, unevenness, any struggle or inability to hold. Okay. And there's not a right or wrong way to do this. So if that's what you're experiencing, this is not a test. This is just to kind of gauge cardiovascular, neurological types of behaviors, okay? Okay. So you do seem to be very even, so that's good. You can go ahead and relax. Okay. not always part of cardiovascular health, but with your permission, I'd like to get a little bit close to your eyes to see whether or not you have any constriction or dilation differences from what we would expect. Is that going to be okay? Might require me to get a little bit close to you. All right. Thank you. I'm just going to take an otoscope. It's got a very dull LED light, so this shouldn't be too bothersome. But I want you to just go ahead and look forward for me if you don't mind. Okay, and look to your side. Be your right side. Okay. Thank you. Okay. And again, look forward. You're going to come in on your right and just look forward, okay? Okay. Look over to your left. You look good. So on the surface, nothing alarming. So that's always good news to give people, at least in that aspect. Okay. So these episodes that you had described with Calliope, so I've gotten your initial statements and concerns and also some of the updated notes that she's put in here, but the frequency of these, you've made notes that these are rather frequent and they don't seem to have any rhyme or reason sometimes for happening, but moments when you're not experiencing these tend to be when you are sleeping. So from a cardiovascular standpoint, when you're sleeping and your body is in a more relaxed state, if there's any other influence that would cause heart strain or cardiovascular strain in your arteries, things like plaque buildup and high blood pressure, things like that are reduced usually when most of us are sleeping. So that's going to be where my focus is to look at it from that angle. Okay. But if you experience these on a regular basis, I would like to, towards the end of this exam, equip you with a heart monitor. And this will offer us insight in a couple of different ways. First, when these episodes are happening, we'll be able to see what your heart rate and your blood pressure is at. And when you're at rest, in comparison to these moments, your normal moments, or at least your baseline. Normal is not the best word to be using. I guess I would say your normal baseline, where you are in most awake circumstances. Okay. And then compare those numbers to moments when you are experiencing these and the moments when you are much more reduced in stress. Okay. All right. I'm going to start with your breathing. I want to listen to your lungs. I want to also listen to your arteries in your neck. Also kind of palpate around the areas to see if there's any abnormalities in your pulse, elevation in heat, temperature, things like that. Would that be okay with you? This might require me to get a little bit close to you, also to place my hands on various areas of your chest and your back and your neck. Is that something that you're okay with? Okay. And if at any point any of this does not feel comfortable or you begin to experience one of these episodes, let me know, okay? All right. I'm going to try to be as gentle as I can. All right. So to start, just go ahead and breathe normally for me. No extra effort, no holding of the breath, no trying to force a certain rhythm, just what you would normally breathe, okay? I'm going to reach around to the back side of your left. Okay. Okay, I'm just going to push your shirt to the side a little bit here. Can you lift up your left arm for me just a little bit here, okay? I'm going to do the same on your right side. So again, no conscious efforts to breathe in any specific way other than normal, okay? Are you doing okay? Just checking in, okay? It's okay if you need a moment. Just let me know at any point. And again to your back here, so I'm just gonna push your shirt to the side a little bit on your back. Okay. And I'm gonna move down to underneath your right arm here, so go ahead and lift up your arm for me a little bit. I'm going to listen to the arteries in your neck here. Is that okay? Okay, I'm going to brush your hair to the side. And I'm going to be listening for any kind of echo or rhythm imbalance or anything along those lines, okay? Okay. Can you go ahead and just swallow for me? Mm-hmm. And now on your other side here. So. Okay. All right. Listen to your heart for a little bit here. So this might be a bit longer, okay? You doing okay? All right. You're doing great. Just listening to the different bells in your heart. Okay, can you lift up your left arm for me again here? It's easier to hear this from the side. Okay. Okay. Go ahead and relax. So, some good news is that I don't hear anything abnormal. If you have any kind of plaque buildup or an obstruction, especially in the arteries in your neck, a lot of the times you'll hear a difference in the way that the blood is circulating in that area, and I'm not hearing anything like that, so that's always a very good observation to make. There's always possibilities that we can't hear, so what I would probably recommend is after we run the tests with the heart monitor for a couple of days, we'll be able to reevaluate whether or not something like an echocardiogram would be an appropriate thing to test for. Just real quick, I'm going to update some of these notes here that I can pass along. So, how are you feeling? Yeah, I'm sorry. It's not always easy to feel like you're peeing under the microscope. Okay. So, at any point, if there's anything that comes across your mind that you'd like to talk about as I'm documenting this, notes that you think would be relevant to your case, certain instances, behaviors, scenarios where a lot of these things occur, don't hesitate. Speak up, let me know, because they're all relevant. Yeah. Okay. I'm going to, with your permission, focus on some of the glands that you have in your neck. When people experience lightheadedness, if you feel like you have any kind of restrictions or the pulse feels a lot heavier in certain areas of the body, I just want to take a couple of moments and to focus on those primary areas to see whether or not there's any symmetrical differences between your left and your right. Okay. This is going to require me to get a little close to you and to touch your neck. Are you going to be okay with that? If it's not, at any point, if that changes, let me know, okay? Gonna get a little close to you. Okay, so I'm just going to place my hands on the side of your neck here. Okay. Just give you a little bit of pressure. Feeling your pulse. You're doing great. Okay. This is a safe space. You can feel whatever you want to feel, okay? If you want to talk about it, that's okay. I'm going to run my fingers up the back of your ears and around your back of your scalp. Is that going to be alright? Okay. Just let me know if it becomes not alright. Okay, we'll stop. Moving down your chest. Slightly palpate this area here. Okay, so I'm making notes on here that you're not experiencing any temperature elevations in any areas. So that's usually good. Okay. You do have a slight reddening of the chest area here. That doesn't look like it's anything like a sunburn or rosacea or anything like that. So, are you feeling anxious right now? It's okay. It's okay. I know this isn't fun. Okay. I'm going to go ahead and just take a moment here. I'm going to update some notes here. Get prepared for the last portion, which is the attaching of a heart monitor, if that seems something that you would be okay with. Alright, so I'm going to update in some notes. Just take a moment, take a breather. You're okay. And as of right now, compared to when you first came in, did you, on a scale of 1 to 10, what is your level of ease? Are you more comfortable now, or when you first came in, would you say you were more comfortable? level of ease, 1 being completely calm, not bothered at all, 10 being to the point where you feel like you're not able to process things. When you first came in, what would you have rated yourself? Alrighty. Moving on to the heart monitor. The heart monitor is going to be present on your chest for, with your permission, of course, 7 days, and this will allow a couple of different things. 1, to get a baseline, find out what your medium is, and if you are normally elevated, indicators of things like high blood pressure or hypertension, things like that, we'll be able to observe in long increments of time when you're normally awake and compare that to moments when you're asleep, where, you know, that consideration is not so much a factor. It'll also allow us to look into, on a cardiovascular level, whether or not these moments of stress are reflected in your cardiovascular, your heart health, your pulse, your blood pressure, that sort of thing. And ultimately, I mean, as long as you're in good cardiovascular health, rule out or to find a treatment for, you know, whatever those results are. Okay. So with the heart monitor, it's going to go in the center of your chest. And to do this, I usually start by cleaning the area right in the center, using a razor, shaving any hair, even if it's just like peach fuzz, because we want to make sure that that node is going to stay there for a good long time. It's secure. It's also going to be accompanied with a smartphone, so this will allow us to Bluetooth connect with this monitor. I'll be able to see the results in live time, so if there's any kind of an emergency, we'll be able to see what's going on from that angle. And you probably have about, I want to say, a 50-foot radius that it would be recommended staying within the range of the device. So I'd recommend keeping it with you at all times. It'll come with a carrying case, a carrying bag. Keep it on your person as close as possible. The monitor itself is going to be water resistant, so you should be able to have your normal showering activities, swimming activities, anything like that without potentially damaging any of the equipment. The equipment is warranted, so if that happens, don't even worry about it, okay? It's not going to be something that we're concerned about. Does that sound okay? Alright. So, move your shirt to the side a little bit here. I'm going to wash the chest area where this is going to go, and then adhere the monitor. Make sure that the two are synchronized. Give you kind of a breakdown of some of the aspects of the application, and then go from there. Wonderful. Let me just grab a sanitizing wipe. Do you mind if I push your shirt to the side here so I can see the area? Thank you. Okay. Just going to clean the area a bit. Yeah, it's a little bit rigorous. I know it's not always so comfortable. I'm sorry. I'm going to take a disposable razor and shave the area. Is that okay? I'm going to make good skin contact. Okay, so just try to remain still if you can. Is this okay? Okay. Let me know if that changes. So you're going to get 4 nodes, and these can be interchanged. Most people choose to wear them for 1 to 2 days, maybe 3 days, depending on, whether or not it feels itchy or you're sweating or anything like that. I completely understand. They are rechargeable. The smartphone is going to be rechargeable. It's just your average smartphone, but there's going to be an application intended to run at all times for that, okay? So I'm going to start by first attaching the pad to your skin. Okay. Just going to move your shirt to the side here. There we go. Okay. Just nicely securing it. And there's going to be this little transmitter that kind of just slips in. And it's got this little pocket right here, so I'm just going to tuck that in right there. And the flap goes down, holds it in place. Okay. Does that feel? If you shift around, do you feel it pulling on any of your skin too uncomfortably, anything like that? All right. I'm going to take just a moment to connect to it through Bluetooth. Okay. And it looks like we are connected. And we're doing good readings. Beautiful. So this phone has a new battery, and it should be good for up to 72 hours. So you want to keep this as close to your person as possible. It's going to come with a carrying case, so if it's easy to carry on your person, that would be ideal. Bluetooth has somewhat of a limited range, but obviously if you're going to take a shower or something like that, leaving it on the sink, and that sort of activity is expected. If it does get disconnected from the device, it will automatically seek that device back out. You can always check on the device to see if it is connected. And if there's any kind of complications, don't hesitate to give us a call immediately, okay? And then we'll monitor you for the next week. Hopefully it will come up with some insightful results that can help us process what the next couple of steps will be. But I'd like to leave you with the comfort that we're going to be paying very close attention to this and that everything is going to be okay. Whatever the answer is, whatever the next step is, that you're going to be in caring hands for that. Okay. On your way out, if you want to say goodbye to Calliope, and we'll hopefully see you in a couple of days, and we'll go from there. All right, you take care as best you can, and we'll be monitoring you. Have a good afternoon.